So hopefully you can all hear us now and you can see some of our cameras. So first of all, welcome everyone. Thank you so much for taking time to join this webinar today. My name is Charmaine Jackson and I head up the training team for Ardens, and this webinar is all around how we at Ardens can support you with the childhood vaccination delivery. So a very relevant topic. We are going to touch on what the schedule changes were just recently, so we'll touch on that lightly. And this is for our EMIS practices. So if you are a System 1 practice, then the webinar happened yesterday. So what I'll do is I'll get one of my team members to be able to share the recording just in case you have entered the wrong webinar today. So I have got a few of my other colleagues that you can see on screen. So I would like to introduce you to them first before we start the webinar. So first of all, we have Amanda, and Amanda is one of our training specialists working for the Southeast region. So Amanda's going to be helping out with the questions today. I also have two of our GP developers on the call today, which I'm really pleased to have on the call today as well. So welcome Stacey and also Tudor, both working GPs and have very much been the brains behind updating the template for childhood vaccination delivery. So it's really good to have their input on today's webinar as well. And not forgetting Stuart Webb, who is one of our senior developers, and Stuart has been working very hard on our reporting suite to make sure that's working perfectly for you in order for you to be able to identify exactly what you're doing. Now, in terms of housekeeping, I know that most of you have probably joined us before, but in terms of housekeeping, let me just get to the previous slide. Bear with me. You're not connected to a camera or a microphone. This is how we normally set up our webinars. So if you do have any questions that you would like to answer, then please use the Q&A option. If you are new, maybe take some time to find where that Q&A option is while you're there. Also look out for the pop-out option. The pop-out is very good to allow you to see the screen that I'm sharing rather than all of the cameras and names on the screen. It just lets you focus on what I'm showing you. Now, the session is scheduled for 1 hour. We will try and keep to that time as much as possible. And if you do need to jump off early at any point, don't worry, the session will be recorded. And everyone that's registered on the webinar today, we will make sure that you have the recording sent to you. And we will also make sure it's on our website as well. Now, what we're going to be covering, we're going to touch very lightly on the background. What was the recent changes that you now need to do? How can we help you? And then I am going to give you a live demonstration walking you through how you can use our resources to plan, to recall, to deliver, and also evaluate as well. So you've got those really useful insights for your childhood vaccination activity. At the end, we will give you a chance to be able to verbally answer your questions. So if you do want to raise your hand at the end of the session, we will unmute you and you can voice your question, but we'll save that to the end. But we will be answering questions throughout the Q&A throughout the webinar as well. So do make sure that you're making use of that. We want to make sure that you're confident with these resources when you walk out of this webinar today. And at the very end, I will talk to you about training and support, because training is free. We recommend that you should be doing it every year just to make sure that you're up to date with everything Ardens. And we'll talk about how you can book on for your practice or your PCN or your ICB. Now, in terms of updates then, there have been some recent changes, but we knew about these schedule changes nearer the beginning of the financial year, didn't we? So we knew that there was a phased approach. We knew that it was going into 2 phases. And the first phase was back in July, which you're already working on. And that's a schedule adjustment. So looking at MEMB and also PCV. And also there was this discontinuation of HIB-B and MEN-C as well. We also see an increase of the item of service to £12.06. So everyone that you vaccinate correctly, you will be getting that paid amount. Now, the 1st of January, we have recently seen the changes for. So the patients are now becoming eligible for this. And the changes you can see on screen here, but what was very new was this new 18-month vaccination appointment, in which that time, anyone born after the 1st of July 2024, this is who it was impacting, you had to offer the 4th dose of 4-in-1, which replaced the HIB-B and MC, which was discontinued. You also had the new MMRV vaccine, so this is a combined vaccine, which replaces the MMR, and this is to be given twice at 12 months now and also at 18 months as well. And this was then replacing what was given at 3 to 4 years. So it was brought forward. We now give the first dose at 12 months and also the second dose at 18 months. And I've already mentioned they also receive a fourth dose of 6-in-1. So a very, very busy 18-month appointment, must I admit. But all of these changes you would have been aware of. So what are we doing to help you? Now, this is where we have, with all of this in mind and all of the changes that have happened over this financial year, we have made sure that all of our resources have been updated to reflect that. Our templates, we've also got bravery certificates, which I'll talk to you about today, and all of our reporting suite as well. So we made sure that every resource as part of childhood vaccination delivery reflects the very latest vaccine schedule, so you don't need to worry about that. We also wanted to improve clinical accuracy, and we also wanted to enhance your experience when using this template as a clinician to make sure you knew exactly where you needed to go depending on what vaccination appointment you were doing. And you'll see that when I show you the template later. As part of Ardens, we're all about data quality. We want to make sure that we service anything that may be an issue for you. So we continue with our data quality in this area. We have provided you with reports to make sure that coding is accurate, and we've provided you with reliable searches that you can be using. And we've updated our invitation suite for all of our vaccinations. We're working on this at the moment, so you know exactly where to plan, where to invite, and where to do your data quality, and we'll speak about that today as well. So how are we helping you? Now, we are helping you with every part of that childhood vaccination delivery. So from the planning stage, we want to make sure you know exactly which patients you need to be targeting. We want to make sure that there's no data quality impacting your patients being brought in. We want to help you with the inviting process, so that's as easy as possible. We also want to help your clinicians with actually vaccinating the patients, not physically vaccinating them, but giving them guidance on exactly what they should be doing. And we also want to help you monitor your performance in this area. We know childhood vaccinations is challenging in itself. We know it's part of QOF, it's part of enhanced services, it's part of everything. We know that for certain areas, it's really hard to achieve that. So we want to try and help you as much as possible to understand what your activity is. And we do this all by providing you with templates, protocols, and also the Ardens Manager Dashboard, which I will touch on lightly at the end of the session as well. So I hope this is all making sense to you so far. I am going to do a live demonstration now, but it's just to mention we are going to be sharing these PowerPoint slides, and what we've done is for every part of the journey, we've popped on some screenshots of exactly what resources you should be using. So this would be a really helpful reference point for you that you can use at any point, and we will make sure that this goes and with you with the recording as well, so that you can access that too. Okay, so I'm going to pop into my EMIS system now. Now, note that the system that I'm using is a test environment, so the patients that you see on screen will not be real patient information, but how I actually use the features today will be the exact same way you would use it when you log into your system and start using these childhood vaccination reports. Now, what would be really good actually is to understand, and I'm just going to pop up a poll question, exactly what resources are you using at the moment, because that will then give us a good understanding of where we want to get you and all of the different resources that are available for you. So I'm just going to pop a poll question, which takes a second to just answer, and that will be really good to give us an understanding of where you are at. So you should have a little question there that now says, what resources are you currently using? And you can pick more than one on there, and then we can then have a look at those results before I dive into a live demonstration. Very, very similar to the results that we had yesterday, Stuart and Tudor as well, where yeah, lots of people are using the template, but very, very low numbers on the bravery certificate, the report and the dashboard. So hopefully by the end of the session, we'll change that. You'll be aware of exactly what else is available for you, and we'll answer you that question again at the end of the session. Okay, so moving on then, we're now going to have a look at the planning stage of your childhood vaccination delivery. And you may have done a lot of this already, but I do want to remind you of what we have available for you. So when it comes to planning and when it comes to inviting, it's all done by the use of reports. You have to make sure you're in the population reporting module. and you're clicking on the Ardens searches folder, which will find you all of the reports that we have available for you. Now, note, it doesn't matter what version of Ardens you are on, what package you're on, you will all have these searches just as long as you are an Ardens customer. Even if you're on a 3-month trial at the moment, you will still have access to these reports too. And within the reporting folder, what you want is 3.22, vaccinations, childhood 26. That's the folder that you should be focusing on going forward. Previously, I think it was called childhood recall. Amanda, you may be able to correct me on that, but there was a different title for it. This time, though, going forward for these changes, you need to be making sure that you use this folder. Remember, we automatically update you every 21 days anyway. You can request an update sooner than that if you're looking at yours right now and it's not looking the same. So when you open up the folder, it's then broken down by the following. When it comes to anything to do with planning, you're looking at these first 3 folders here. So I'm going to start from the top and let you know exactly what you've got here. So the cohort folder will provide a report of the total number of patients who are registered at your practice and they're aged between 4 weeks and 4 years. It doesn't matter whether they've had the vaccine or not. This is just giving you a total number, so you've got a rough idea of how many patients this may impact. Now, you can click on the report here. Once you run it, it would definitely be more than 6 patients, I'm sure. And when you view the results of that report, it will tell you who the patient is and their ages and their date of birth. So it's really just for information purposes only.
Charmaine?
Yes.
Just before you go any further, can I break it? The poll you've published only allows one answer.
Okay, fine. Cool. I think yesterday anyway, to be fair, a lot of it was template. So I think we've kind of got the same results. So thank you very much for taking time to answer that anyway. Okay, moving down then, we then got the review before folder. Now this is what we feel we recommend that you should be running every single time you're about to do a big inviting of your patients, because this is making sure then that you are not missing out any patients that should be on your list, but they're not due to particular reasons. So your review before folder, if you've not run it yet, I suggest you run it now and get someone to do the work for you in the practice. And then maybe, like I said, every time you're about to do a big amount of inviting, you check your review before folder. Now, what this is doing, it's highlighting patients by their age ranges. You can see it's broken down by age ranges, who have had a decline code recorded in the last 12 months. Now, it might mean that the patients have had part of the vaccine schedule or none, or just part. And this is going to give you insights into where parents may have allowed some vaccines to be done, but not all. And you may want to look into that further. It might mean that you look into these patients as well and check to see whether the decline code is actually right. It's not been recorded by mistake at all. It might mean that the patients had the vaccination somewhere else, which you haven't picked up, but it's gone in as a decline code. You didn't need to do that. So I would definitely recommend that you have a look at each of these reports and look into these patients. When you click on view results, it tells you who the patient is, and it will also tell you when that decline code was entered in their record. And we're going to talk a lot about decline codes because that was a question that came up a lot yesterday's webinar. But when you are declining, you are making sure that you're declining for each of the vaccines in that particular schedule, depending on the patient's age. Now, your due folder will narrow down those patients who are eligible now for their vaccines, or they're eligible soon. So soon means that in the next 4 weeks they are due vaccination, and it takes you right up until the day before the scheduled date when it's needed. Due now is obvious, it's due right now. Now, these reports are information only. You're not using these reports to invite, it's just giving you the heads up of what's coming. So you can think about your resources. I've got X amount of patients who are due their 8-week childhood vaccinations in the next 3 weeks. Have I got the capacity to do that? Let's look at my resources. That's the purpose of those reports there. When it comes to, and it's both the same, so you've got due now and you've got due soon, and each of them will be broken down by your different age milestones, your 8 weeks, 12 weeks, 16 weeks, etc. And then when it comes to inviting, then that's when you're going to use the invitation folder. And again, we've broken it down by those that are due soon and those that are due now. Soon, meaning in the next 4 weeks, if you want to be proactive and start inviting patients in earlier. and due now means that they really do need it now, and you don't want to miss any timings. For the due soon, very straightforward, just gives you a report that you can then export and you can invite those patients in. I'll show you how to do that in a minute. Due now, though, we've broken down by the different milestones. So if you wanted to just focus on 8 weeks for now, or maybe your colleague is also focusing on 12 months or that new 18-month appointment, you've got the option to be able to break down reports in that way. Now, for each of the folders, it's then broken down by patients who need a first invite, patients who need a second invite, and patients who need a third invite. So for your first invitation, they haven't had those vaccines for that particular age yet. They need to be invited. You invite them in. If after 2 weeks' time, they've still not had those vaccines, they will fall down to the second invite. If after 2 weeks' time, you've now sent them a second invite and there's still no response and they still haven't had those vaccines, it moves down to the third invite. So that's the logic it takes for each of those reports. If it's been more than 3 invites, they're still not responded, then they're going to be picked up in this report here, which is full follow-up invite, which you may want to review and decide how you're going to further action those patients. Now, as soon as the patient has had any of the vaccines, then the patient will, of course, come off these reports. If they've contraindicated, they won't appear in these reports either. And if they've declined, Stuart, correct me if I'm wrong, they will not appear in the reports if they've declined as well. But you do need to make sure you put a decline for each vaccine. Go for it, Stuart.
Yep. So as long as they have an exclusion criteria for each of the vaccines at that particular stage, then they will come out of that report. So that is either the vaccination has been given, the vaccination at that stage is complete according to the Green Book, or they've had a decline contraindication code added, and they will last for 12 months, otherwise known as an expiring exclusion, or they have a adverse reaction, that's a permanent exclusion. So if they have any one of those things for each of the vaccinations at a given stage, then they will come out of the invitation for that stage.
Okay, thank you very much, Stuart, because I know that definitely needs some clarification, so thank you. The other thing to note is they will only move down if they've had all of the vaccinations complete for that particular age. If they don't, and there's incomplete vaccinations, they will move down to the review after folder, and I'll cover the review after folder shortly. So here are our patients. Very simple. We run it. That will then provide us with our list of patients that we need to invite. And then from there, we can then use that, export that report if we want to batch text those patients to invite them in for their vaccines if you do it that way. And in order to do that, I'll just wait for this to queue quickly. I select my report. I then click on view results. And then from there, I've then got the export option. I can click on export. The option that I want is CSV, and don't worry, we've got instructions on all of this for you. You can then tick the top option and the bottom 2 and click on OK, and that will then export a CSV file out. If you're quite used to using our recall systems or invite reports in general, you're probably quite used to doing this already. So those are your patients that are due now, and that's right the way up to 3 years and 4 months. And then anyone that's due soon, we just group those all together rather than break down by first invite, second invite, third invite there. So you've got that. Now, in terms of invite codes, and I'm going to get one of my colleagues to share the support article, but if I just pop up the support article here, this goes through the whole process for you. And what we've done under the recall section is we've listed out all of the different invite codes that these reports are looking for. So it's worth just looking at that support article, making sure you save this as a favorite, sharing this with whoever's going to be doing your inviting so they know exactly what codes they should be using. Now, that completes the planning stage, the planning 1, 2, 3, and then the recall stage, which is your invitation folder. And what I'm going to do now is I'm going to stop. I'm going to invite Amanda. Is there any questions that have gone in the Q&A, which is worth talking about at all?
We've just been, I have just been answering a few, Charmaine.
Okay.
I have put some questions on there, and I have answered some. One is about the SCID result.
Yeah.
I've answered that. There is a tick box on the new template now. Please, can you cover what advice you give to practices when identifying coding errors on the system?
What advice to give?
What advice we would give to practices when identifying coding errors on the system?
To use our data quality reports would be the first thing, because the data quality reports will highlight where there is coding errors. Then using our templates to help correct those coding errors. If there's a particular area that you are interested in us supporting you with, then maybe just contact our support team or our training team and we can get some training booked in for you. But use the data quality reports for Ardens. You should be running them, I would say, at least once a month for everything, so that you're not missing out on any payment or anything in any way. So that's what I would suggest.
That's it. Thank you.
Okay. And Stuart, reports are your baby. So is there anything more that you want to add on those 4 reports before I move into template?
Sorry, I was just answering a question, but I think it's already been answered. Invitation reports. No, I think you've covered it. Clearly. The only thing to mention, I think, just in case anyone's wondering, is regarding in the due soon folder, the 12 and 16 week. So either invitations due soon or due soon. The 12 and 16 week searches and reports will very rarely show any patients because you have to be 4 weeks from having your previous vaccination to appear as due for your next vaccination. Unless your 8 weeks were given early, you won't appear in soon. In the soon folders for 12 or 16, you will go straight into now, so due now.
Okay, perfect. Thank you, Stuart. Okay, so we've done our inviting now. Patients are now due to come in to be vaccinated, and this is where we move on to the administer part. So I'm just going to go into the patient record now and show you how you can now launch the childhood vaccination template, which has now been updated. So what we've done is we've created you a new template launcher. Now we provide you with a number of template launchers to help you access any of the Ardens templates that you need from anywhere in the patient record. Now, if I just press F12 on my keyboard, the new vaccination launcher template, which is worth adding and letting your staff know about, is this one here, Vaccination Launcher Ardens New. We really strongly recommend that you access the childhood vaccination template from there, and you will see the reasons why in a minute. So every individual person will need to add this to their F12 key. And it is just a case of going to right click on an available letter or number and then clicking on the option for add. So every individual will need to do that. And what you're then searching for is the vaccination launcher, Ardens new protocol. We can pop a screenshot in the Q&A so you remember exactly which one you need to be using. When you double click on that launcher, it then opens up a multiple choice question on the resources that we have available. So this is here where you can open up our template. You can also open up bravery certificates, but I'll talk about the bravery certificates in a minute. If it doesn't look like this, it might mean that you just need to do a quick refresh and resource publisher to make sure it is updated. But we did update this quite a few weeks ago now, so all of you should be looking at this version right now. So when I click on the childhood vaccination template, that will then launch the template for me. And just while that's loading, just to note, anything relating to childhood vaccinations in the pink box here most likely will not be an Ardens alert. We only provide you with the template, we provide you with the bravery certificate, and we provide you with the report. So it's just worth noting, if you're having any issues with alerts, we don't provide those for you, so you would need to get in touch with the relevant organisation. Now, the home page, so what we've done is we've tidied up this template for you to make it really clear on exactly where you need to go depending on what appointment you are seeing currently. So whether it's 8 weeks, 18 months, etc. The home page will summarise the patient's vaccination schedule to date. So at a glance, I can quickly see what vaccinations have been given. So this is really helpful. If I'm doing my 12-month appointment, I can then just look back to see whether or not the patient's vaccination history is up to date. Just by looking on the right-hand side, it will tell me exactly the date that the patient had been vaccinated along with what the vaccination is. So I can have a quick look at that before I then launch into my pages on the left-hand side. You do have a consent page here, but to be fair, all of your consents and your declines are also built into these pages as well. So let's say, for instance, I've got a patient who is 8 weeks and I need to follow the 8-week schedule. I click on 8 weeks and that provides me with the information that I need. Here I've got my assessment stage, so I can say who the patient was accompanied by, so one of the parents. I can also say that consent has been given. And notice on the right-hand side, we are trying to populate some of the fields for you, so it's just quick and easy so that you can focus on what you need to be doing within that appointment. Now, we've had the SCID question come up already, so I will explain it, but I'm also going to invite Tudor on to explain it because he explained it really well yesterday. But you have got the option to check the latest status of the SCID screen in here, and once you've checked the status, you can then tick the box to say that you've checked it. But Tudor, do you just want to talk about the reasons why we've removed the SCID option from the template? Would be beautiful. Thank you.
Of course, yeah. So actually, that latest SCID will pull through any existing codes that are in the records. Obviously, SCID's a thing, it's not national, the SCID testing. So it's part of the newborn blood spot screening test, and also there's a lot of other contraindications to having a live vaccine rather than just the SCID result. And so we've included that area as that says latest SCID to try and drag as many of those codes that have been put in the notes through. But then the actual tick box is just to say that there's no contraindications to the live vaccine.
Thank you, Tudor. Thank you. So there is the option to tick that you have checked it, and like mentioned, you've got the latest one in there as well. Now, moving down then, this is where we then move on to the administer stage. So what we're doing is we're recording the fact that vaccine has been given. When it comes to issuing the prescription, you use an alert that EMIS have provided or Optum have provided for you. So I'll talk about that shortly. But depending on how old they are, it just leaves you with the vaccinations that you should be given. So for 8 weeks, you've got your first 6-in-1, you've also got your MenB, and you've got your rotavirus. And when you click on each of these pages on the left-hand side, that will be updated, reflecting what you should be giving at that time. So really easy for you to use. When you tick on what you've given for that patient, here you can then complete the manufacturer details. You're used to this anyway, the manufacturer details, expiry date, batch number, GMS or not GMS, and where that injection was given. So you can pop all of that information in. Same for MenB, same for rotavirus as well. Once you have vaccinated, you then got the option to say that you've given further advice to that parent about the vaccines that you've given, any further information that you need to give them around feeding. Maybe you want to collect any notes. You've got the free text box to complete there. And when it comes to PGD and PSD, you then got the options to say that it's been administered or authorized. Now, this is only you just recording the fact that it's been administered or authorized. Any processes that you normally follow with PSD locally, you will continue to do that. Now, that's the same for each of the pages, but you've given the vaccination now, and it might be at this point you've got an unhappy baby because you've just given them a vaccination, and you may want to, at this point, provide that child with a bravery certificate, or the parent, depending on who's most stressed at that time. So what you can do from here is you can press F12 on your keyboard, even with this template still open, and you can move down to your vaccination launcher. And then you've got the option for bravery certificates. So I can click on bravery certificates, and that gives me a number of different bravery certificates that I can be providing for that patient. I can click on whatever one is relevant. And what that will then do is it will launch the bravery certificate for me so that I can quickly get that generated and handed over to the parent, the child, so that they can walk away, hopefully a bit more happier. Just wait for that to load. Any questions on the templates while we're waiting for that to load, or any information, Stacey or Tudor, that you want to provide more on the templates for those on the call? No? Okay, no problem. So there's the bravery certificate. Here I've got the image there, the certificate itself, and then once I'm happy, I can just file and I can print that bravery certificate, hand it over. I can also save and close it back to the patient's record as well. So I have got the option to do that, and I can still do that even when I'm in my template. You have got the option to launch the bravery certificate, like you know, through that launcher as well if you want to. Now, we've had a lot of questions around practices who are still needing to record MMR. And that might be because the patient was born before, they're playing catch up, the patient was born before the eligible date, and they've been answering about how do we record MMR. Now, Tudor, you can correct me if I'm wrong, but everyone going forward should be vaccinated with MMRV. We do have this MMR catch up page. So in your experience, when would they only be using this MMR catch up page?
Yeah, so I think the key thing is just to say that during the national schedule for childhood vaccinations, MMR's dropped out of that. So all the places where you were giving MMR in the past, then actually you'd be using MMRV now. I think some of the national comms around it wasn't quite clear to begin with, about just because they had quite defined date of birth cutoffs for people. But all those children arriving at appointments, they should now be having MMRV as part of their routine schedule rather than MMR.
Thank you very much. And you've got that page there as well. And then the only other page worth noting is the uncertain incomplete page. This is really useful if patients have had vaccinations done elsewhere. What we've included on here is the UK schedule and the non-UK schedules. If you are playing catch up at all, particularly for patients who are coming from abroad, you've got all of the relevant options for you to be able to record that information safely back into the patient record. So that is your uncertain incomplete record page that you'll be doing for those patients who are being vaccinated elsewhere. And hopefully that should be pretty straightforward. And once you've completed all the information, of course, you then save that back to the patient's record, and then that's the vaccine now recorded in. Now, when you do save it back to the patient record, what may come up as an alert from Optimum is the fact that you also have to record the vaccine as well. And I know that's new for Optimum and new for EMIS practices in general. So this alert may pop up to say, look, you've just put a vaccine in, you now need to record the vaccine. And I know I've seen it, and I know that you just record it into your notes. You don't have to physically print it, I believe. So just note that that alert may pop up, but that's an alert that's been generated by Optimum rather than Ardens. So we're just providing you with the template. So just really looking at the evaluation part now and how you can look at activity for your childhood vaccination. So going back into population reporting, and under the 3.22 folder, you've got the review after reports. And the review after reports are identifying any patients who have incomplete vaccines. It breaks it down by the different ranges for you. And if you select any of these reports and click on the view results option, it will then tell you exactly what is missing, so that you can see it very clearly and play catch up or try and chase those patients if you can. You can export these reports. You can do all of the normal EMIS functions that you need to. So suggest that you should be reviewing these on a regular basis. We also take it all the way up to the 25 years if you want to play catch up on some of the older children as well. So these are all here ready for you to use to make sure that you are keeping on track. And I'm going to stop there. And before I launch Ardens Manager, I'm just conscious that we haven't looked at a lot of the questions. So any questions that we want to just pick up and discuss before I move on to Ardens Manager? And I'm going to stop sharing my screen for now while I load Ardens Manager. So over to maybe Amanda and Stuart to talk about any questions that we've had coming through.
Just having a look down the list, Charmaine. Sorry, just having a look, of which there are a lot of questions. Right, okay. Where can we record vaccines that are given abroad? There seems to be quite a few on the same lines of that. Actually, Dr. Ringham, you've answered that, so that's okay. That's on the incomplete. Does the template auto-populate the date the vaccine was given? Yes, it does, I think. Yes, it does. Do we have to generate a script? There's been quite a lot of questions around that. Okay.
No.
Quite a lot of the same around that one.
They record it in notes. They record it in notes, don't they? But they don't have to physically generate the script, no.
Okay. When we have to code to add administration to another location, this has been asked quite a lot. How do we now do this? Codes elsewhere. I think that might be the one.
What was that? Sorry, Amanda.
Sorry, when we have to code administration, at another organisation.
So the incomplete page, is that what you're giving the answer for?
I haven't answered that one, I'm afraid. Is that non-GMS, so that they don't get paid for it? Would it be that one?
That is, yes, Amanda. Yeah, that's non-GMS.
Thanks, Judah. Okay. Same question, should we be ticking GMS? So if they are giving the vaccine at their practice, should they be ticking GMS for payment? Yes. I'm guessing yes. Yeah.
They should, yeah.
Yeah. Why doesn't the template ask for the brand given?
Well, so the drop down of each vaccine, one of the qualifiers, the first one is manufacturer. And so they can put the brand name there under each of the vaccine options.
Cute. I had quite a few along that line. I think that's probably it for now. We'll keep going down.
Okay, no problem. And that's just good timing. I'm just logging into Ardens Manager. So Ardens Manager is kind of the last thing that I want to show you. And then we will do an open Q&A and we can invite you to answer some of your questions. So just bear with me while my Ardens Manager fires up. Amanda, it might be worth just having your Ardens Manager open just so that I can talk through on your screen if that's okay. Got it up? Can we share your screen quickly, Amanda, so we can have a look at Ardens Manager and I can talk through it. So while Amanda's sharing her screen, so Ardens Manager is our population health management tool, and it allows you to be able to monitor data at a wider scale for areas such as demand and capacity, QOF, network contract DARES, but we do have vaccination dashboards. So it might be worth at this stage also just checking. I'm just going to launch another poll question, just bear with me, to check to see how many of you are actually Ardens Manager customers and if you are currently using our dashboard. So just bear with me. I'm just going to launch that poll question now. While we just wait for Amanda to pop it open. There we go. Just launching that now. So let us know whether you are an Ardens Manager customer. If you're not sure, let us know that as well, because that's helpful. We can also get in touch with you to let you know. Okay, quite a few people who I'm sure, a lot of you are an Ardens Manager customer. Yeah, perfect, brilliant. Okay, cool. So this is Ardens Manager here now that you can see on Amanda's screen. And over on the left-hand side, we've got the option for services. And within services, we then got the option for vaccinations. And what we do is we provide you with a dashboard for each of the different vaccines. Now, one of those is childhood vaccinations, which Amanda would just open up for you. And what this is doing, it's giving you a count of the number of vaccines that have been given over time. So basically last month, it will give you a breakdown of how many 6-in-1s you've done, how many MMRVs you have done as well. So this is really handy if you're asked by anyone centrally, such as a child health department, maybe your ICB or your PCN is answering you for your childhood vaccination activity, you'll be able to get a quick number here. Now, what you can do, and Amanda, if you can just click on the view button on one of them that looks a bit more populated, we are using a test environment. So, yeah, the data is not as good as what yours would be, but you can see there that I've got the ability to benchmark data across organizations as well. So if I'm looking at this at a wider scale, I can see exactly how much we're achieving throughout my group. I can also, for my organization, I can click on patients and it will tell me exactly who those patients are as well. And over on the right-hand side, I've got loads of breakdown options to give me further insights on those particular patients. So I can click on demographics, and demographics will tell me exactly what the age range was, the gender, the ethnicity. It will also tell me whether they're living in deprived areas or not. So this is a really good judgment on which patients maybe are not responding, and is there anything more you can be doing. You've also got the map option, which we introduced just recently, which would tell you the vaccinations that have been done by area. So this is really, really good as well, if I wanted to look at it from that level. I can also see what conditions that those patients have as well. So there's lots of data insights that you could be looking at here. I can even click on the staff option, and the staff option would tell me exactly which staff members, right down to name, have been vaccinating. So if I do want to have a look at that and how my resources are being used, I have got the option to be able to do that as well. So that's Ardens Manager. If you're not currently a customer, you can sign up for a free 1-month trial. So do bear that in mind. We will will pop in the link in how you can do that. Amanda's just copying that into the Q&A now. And we can also provide you with training in this area as well. So that really leads us a lot quicker getting through these than it was yesterday, which is hopefully a good thing, because it means that hopefully you understood and you're using the resources as much as possible. We will open up a Q&A in a minute. What I'll do while we are waiting for questions to come in, I'm just going to share my screen again on this one of the very last slides here, which is looking at training and support for your team. So if you want us to come along and train your nurses and making sure they are using that template correctly, then we're more than happy to do that. If you want more training on the reports, we're happy to do that as well. So if you scan this QR code, that will take you to our training page, and then you can book onto all of the necessary training.